Good morning. It's Dr. Rutledge, and I'm going to talk to you today about vitamin C. I don't care that much about vitamin C, but I think it's a good example because I get lots of questions about vitamins. And so the purpose of this morning is to use vitamin C as an example. Many people are taking tons of vitamins, they're taking other pills and supplements, and many bariatric surgeons are saying take tons of pills and lots of other supplements. And so I'd like to give you a little talk about that. And of course, you need to not pay attention to something you see on the internet. This is something you see on the internet. So you're going to want to talk to your doctor specifically about the things that I bring up here if you want to see what he thinks about these things. But you don't want to make any decisions on today's talk. This is just as they say, for entertainment purposes only. But these are my actual opinions, and this is what I do with my patients when they talk to me about this. So, wonder drug or canary in the coal mine. And so, if you're not familiar with it, in the past, when the coal was mined around the world, they would dig down into the earth, sometimes several miles beneath the surface. And with that, occasionally the tunnels would run out of oxygen. If this was found too late, then of course there could be death or other damage to the miners. What they found is that canaries have a very rapid metabolic rate because they're small. And because of that, they would notice the lack of oxygen sooner than the humans in the mine. So they would take down a small cage with a canary in it. And if the canary got sick or passed away, they knew they had to do something immediately or they would follow the canary. Canary was not the dangerous part, but the canary was a warning. And so today's talk is really simple. It's vitamin C. Is it really a wonder drug, a magical drug, a chemical that can change lives and protect against illness and lead to health? Or is it better called a canary in the coal mine, a warning? And I'll try and make the case that it's the canary in a coal mine. Okay, vitamins and supplements. Many of my patients, many bariatric surgeons seem to think that basically more is always better. And it's always best if you can take a pill. If something's wrong, the simplest treatment is take a pill for it. And one of the goals of this talk is to say, maybe that's not really that smart if you think about it. And in fact, at the end of this, and I think I have 60 or so slides, the answer is going to be really simple. I'll give it away now. It's better to actually eat a healthy diet. And so those of you who don't want to go through 60 slides, you can turn it off now. Okay, again, this is a warning. This is for entertainment purposes only. We don't want this to make you suddenly change your lifestyle without talking to your own doctor. We're going to be talking about serious and potentially dangerous topics, including death and wellness. So your health and your life may be at stake, depending on the decisions you make. And don't make changes on this presentation or any kind of internet presentation. You need to talk with your healthcare provider, your doctor, or whoever else is giving you advice in a professional way that takes the liability for caring for you. And that's not what's happening in this presentation today. Okay, what about vitamins and supplements? So here's an example. After 4 years of supplement with beta carotene and vitamin A, there was no benefit and maybe harm. This is a story I'm going to tell you over and over again. This is from 1996, one of the leading journals in medicine on earth. And they took a large group of patients and they found that giving them vitamin A didn't make any difference. Now, you might say, well, so what? Well, because they had been previous studies where they looked closely at those people getting cancer and those who didn't. And those people who didn't get cancer had higher blood levels of vitamin A. So they thought, like many of my patients, and I think many bariatric surgeons thought, oh, we'll just give them pills of vitamin A. It didn't help. And in fact, there was actually a slightly higher risk of getting cancer. Anyways, this is me. For the past 20 years, I've been traveling and teaching around the world, a mini gastric bypass. So I know a little bit about this topic because I have thousands of patients that I've been caring for over those years. And I created the mini gastric bypass 23 years ago, I think now, and it's a relatively simple operation. But patients who have this sometimes can get the risk of low blood levels of different vitamins. And so they often ask me, what should I do? I've been at the other end of a lot of criticism of doctors. They said the MGB was done too fast. They said they stayed in the hospital too short a time. They criticized me because I didn't take out the gallbladder. They said it was like another operation, which caused a lot of problems, and that the pouch and the stomach were too big and they wouldn't lose weight. But one of my favorite criticisms at the time, 23 years ago, they criticized me because I used email and I had a website. So I'm used to disagreeing with the crowd. Today, we're talking, though, not about the mini gastric bypass, but about a problem that comes up to a lot of patients who have the mini gastric bypass, and that is take a pill for it. And so many people listening to this podcast may be suffering from a variety of symptoms and or medical illness, things like weakness or tiredness, obesity, diabetes, osteoporosis, depression, or a variety of other illnesses. And all these things can be causing both pain or suffering or anxiety. And it might seem, why I just need to go to the doctor and get a pill. Pill of supplements I could buy over the counter, over the internet, or at a drugstore. Vitamins, it seems like a safe, simple idea. And you may have seen the internet, even your doctor suggests pills and supplements or vitamins to make you better. The purpose of my talk today is to say, it may be more complicated than you imagine. And so I'm going to give you some background on that to help you in your discussion with your doctor make a better decision. For example, there are places around the world right now in the United States where you can go and get intravenous vitamins, including vitamin C. And they advertise it as being really good for you. And obviously, everyone should have their own opinion, but I say, nope, sorry, nada, no pills either. Not just no IV, but no pills as well. So anyways, let's see why I say that. Again, vitamin C wonder drug. What about taking more vitamin C pills? Or canary in the coal mine. Can pills protect me if I eat an unhealthy diet is a topic that I hope you'll have the answer to when we finish up. Here are some examples from the internet. Health benefits of vitamin C. It treats the cold, cures cataracts, reduces the chances of stroke, prevents scurvy, prevents Alzheimer's disease, decreases high blood pressure, combats cancer, boosts immunity, reduces the chance of urinary tract infection, and increases bone density. This is, I say, exaggeration at the best. I blocked out this person's name, but top 6 benefits: supports the immune system, supports collagen, acts as a natural laxative, contains cancer-fighting properties, helps prevent and fight anemia, contains antihistamine properties. Okay. Vitamin C is important. It's important in disease prevention and cure. It plays an important role in bone formation, wound healing, and the maintenance of healthy gums. It's used in a therapeutic agent in many diseases and disorders, like if you have low vitamin C. It protects the immune system, reduces the severity sometimes of allergic reactions, and can help in the body's battle to fight off infections. But the beneficial effect of vitamin C in respect to human disease, that is, if you give somebody a pill of vitamin C, we know all these things are good when it's in the body. That's what it does. And if you can poison an animal and take away its vitamin C or something like that, or somebody is on a ship without limes or oranges, they can get scurvy. If you have just a normal person, if you give them more vitamin C, can it help with cancer, arteriosclerosis, diabetes, neurodegenerative disease, and metal toxicity? The data shows, and I hope you'll be convinced, that is unproven and probably not true. And so we'll try and explain how these kind of two things that seem opposite can be true at the same time. Okay, just a reminder, dietary sources of vitamin C, it's citrus fruits, green peppers, red peppers, strawberries, tomatoes, broccoli, Brussels sprouts, turnip, and most leafy vegetables. It's not very common in animal sources. So that's meat, dairy, and eggs. So can you guess already who's going to have higher levels of vitamin C? Okay, taking vitamin C seems like a good idea, but in countless clinical studies that have investigated the effects of vitamin C on human health, I don't think we're going to find much. And what we want to talk about is association versus causation. The canary in the coal mine is the question we're asking: who is the murderer versus just an innocent bystander? We found you at the site where the murder occurred, but maybe you didn't do the killing. And that's what we're going to talk about today. Maybe you tell us, maybe it's a warning, wherever we find you, the canary in the coal mine, we often find a murder. But you're not the one who committed the murder, and we can't get you to prevent it. That's the theory that we're going to try and explain to you today. So here's the first part. We find that vitamin C is near the murder, in this case, near the health. Very famous study of nurses' health. And basically, they looked at vitamin C intake and heart disease. And they found a significant inverse correlation. Inverse means vitamin C goes up, heart disease goes down. More vitamin C, less heart disease. Now, they also pointed out most of these nurses were, not starving to death and not dying of malnutrition. So in this group, though, in other words, like say maybe you and I, we are reasonably well nourished. If we could take a pill with more vitamin C, according to this study, maybe we just found the murderer. Okay. In other words, more vitamin C in the nurses, less heart disease. That means the person who committed the murder, in this case, who caused less heart disease, is vitamin C. Look, we found him right there. He was at the scene, or she. The population, though, was well nourished overall, so they weren't starving. Most of the people who did get the heart disease didn't have like very, very low vitamin C. So relatively normal vitamin C, they had more heart disease than the ones who had more vitamin C. So there we have it. We've got our murderer. We found who caused the heart disease. All we need to do now is take the vitamin C pill. No. Okay. Significant inverse correlation between vitamin C intake and chronic heart disease. The study showed that women who had more vitamin C intake had less heart disease. Okay. Looks like we found our murderer. Another large-scale long-term study, the Women's Antioxidant Cardiovascular Study, the final major intervention study using vitamin C examined here. The study found no, what? Wait a minute. Wait a minute, what happened? The study found no effect of vitamin C, vitamin E, or beta carotene on cardiovascular events. What's the difference? The difference is in the previous study, the nurses' health study, they just went out and wandered around to see if people would participate. In this study, they went and gave them a pill. Okay, stay with me. It's a little complicated. In this study, some people got a pill of vitamin C or vitamin E or beta carotene, or they got a sugar pill. And the people who got a sugar pill did no different than those who got a lot of vitamin C. Now, we're going to try and explain that later, but the pill doesn't work. The pill doesn't work. The pill doesn't work. You can hang up now if you've heard enough. The study found no overall effects of vitamin C, vitamin E, or beta carotene. The vitamin supplements made no difference given to people. The current literature provides little support for widespread use of vitamin C in attempt to reduce cardiovascular mortality, in spite of the nurse's health study. How can these two studies both be correct? Vitamin supplements don't work. Okay, this is a quote. Current literature provides little support for the widespread use of vitamin C supplementation to reduce the risk or death after cardiovascular disease. It doesn't work because that was a controlled prospective trial, actually accurately looking for the murderer, and the other was association. It only showed that vitamin C was standing near the victim when he was shot. To use a simplistic analogy, I hope you'll forgive me. How about the common cold? I guess you've heard that vitamin C protects against getting a cold. So this is a study in 2018. They found 8 previous reviews, 45 studies, of which 31 were randomized trials. Now, I'll tell you as a background, people who have more vitamin C in their bloodstream have fewer colds and often have less severe colds. And what this did is looked at 31 randomized trials. That's the best quality for seeing if we find a murderer. We find that it is the cause. And here's the conclusion: 45 studies, including 31 randomized trials, because they kept thinking that vitamin C was the murderer. They were the ones who caused this change in outcome. The conclusion, though, in 2018, from 45 different studies, 31 randomized trials, was the consumption of vitamin C does not prevent the common cold. Okay, recently, there have been some studies coming out about COVID, and everybody gets excited. Like there was the malaria drug. Oh, we found the treatment for, But some of the studies came out saying vitamin C could be important in treating COVID because people who had more vitamin C in their bloodstream had better outcomes with COVID. They were better able to resist the infection with COVID-19. Look, we found the murderer. It's vitamin C. It can help us fight. But the effect of high-dose zinc and ascorbic acid, vitamin C, supplements versus usual care and symptom length and reduction amongst ambulatory patients with SARS-CoV-2 infection. Controlled, prospective, randomized trial. In other words, sugar pill versus vitamin C and or zinc. In this randomized clinical trial with SARS-CoV-2, treatment with doses of zinc, vitamin C, or both did not make any difference. Did not make any difference. And remember, we're saying the same thing again. When they tested it before this study, those who had more vitamin C in their bloodstream had a milder COVID infection. They found vitamin C at the scene of the crime, so to speak. But when they tested to see if a sugar pill was equal to vitamin C, there was no difference. How can this be? How can this be? Well, the answer I've told you is canary in the coal mine, and we'll explain that more. Studies show that those people with more vitamin C in their bloodstream have lower blood pressure. Well, blood pressure is one of the #1 killers in the world. And people with high blood pressure tend to have lower levels of vitamin C. Bingo, we found the murderer. Look at this, it's an association. If you have more vitamin C in your blood, you're less likely to have high blood pressure. I got it, okay, get me a pill of vitamin C. I have high blood pressure. And I don't want to take this medicine because, it has side effects. And people who have high blood pressure generally have lower vitamin C. Got it. Okay, I got it. We found the murderer. On the other hand, here's a study published from the NIH for health professionals. This is a fact sheet. They want every doctor in the United States to be able to turn to this and see that as of March 26, 2021, the National Institutes of Health, not Donald Trump or some goofball from the internet, oh wait, like me. This is from the National Institutes of Health. Compared with placebo, supplementation with vitamin C for an average of 10 years had no effect in total cancer. Okay? No effect. It is vitamin C anti-cancer, just like we talked about in blood pressure, just like we talked about in blood pressure. People who have cancer have lower vitamin C in their bloodstream. People who don't have cancer have more vitamin C. Let me say that again. Cancer, less vitamin C, no cancer, more vitamin C. But in a trial of 500 milligrams, that's a lot of vitamin C for almost 10 years, no effect on the total rate of cancer. And here's the blood pressure one. Sorry, I got these slides out of thing. Long-term effect of vitamin C on blood pressure. Several, not just one. Controlled trials have shown no effect on vitamin C supplements. The literature on vitamin C intervention with intention of drawing a conclusion on its possible beneficial derivative, the results are discouraging. Sepsis. Sepsis is an overwhelming infection by bacteria or a virus that kills you. It's a bad infection in the bloodstream. Recently, again, some character said, look, vitamin C can help. Again, what they found is vitamin C in SARS patients and other infected patients, if it was higher, they had a better chance of survival. So they did a controlled prospective trial. They gave vitamin C, thiamine, or hydrocortisone, or a mixture of all of those in the management of sepsis in the intensive care unit. Conclusions: the addition of vitamin C, hydrocortisone, and/or thiamine into standard care did not improve hospital or 30-day mortality. Vitamin C did not work. Bystander, yes, we found him at the scene of the crime, didn't commit the crime. Doesn't make any difference. Does not make any difference. Don't take vitamin C pills if you want my advice. If you want to take them, okay, but there are other issues. I wouldn't be taking them, but as you wish. Studies have shown those patients with more vitamin C in their bloodstream tend to resist cancer and get fewer cancers. That's what that other paper was studying. But high-dose vitamin C in the treatment of cancer in another study was not effective against advanced malignant disease. No difference. No difference. Sugar pill, equally powerful to high-dose vitamin C. Okay. You've heard about it before. What about vitamin C in the common cold? Again, the answer is nada, no, yet, no. It doesn't make any difference. Many studies, okay? Here's 8 systematic reviews. Vitamin C does not prevent the common cold. What about diabetes? Do you know that people who have more vitamin C in their bloodstream are less likely to get diabetes? Now, this is a remarkable study, and I have to explain it a little bit. What we want to know, again, is we're trying to find out, is vitamin C just the bystander or did it commit the crime? Okay, so what we're going to do now is something that's magic. We're going to do something that has never been done before. It's a brand new kind of science. You might not even understand it. I can barely understand it, but I'll try and explain it. What we're going to tell you is that we can now look at people's genes. We can look at the DNA. And we can tell whether you're going to be tall or short. We can tell if you're going to have brown hair or blonde hair. We can look at your genes, and there are hundreds of thousands and millions of people who volunteered to give their blood anonymously, and we can tell then how they've done, particularly in Britain, where they have universal health care from the government. They have hundreds of thousands of volunteers who have submitted their DNA, and they have access to their medical records. So they can look at your gene and the genes that you have, and they can tell, for example, if you're going to grow up with high cholesterol or low cholesterol, okay? In other words, some genes make your cholesterol higher, and some genes make it lower. Not what you eat, just the gene itself. And the research shows high cholesterol kills, okay? So you can have all these keto people and the goofballs who say cholesterol doesn't make any difference. They don't have the brains to, I don't agree with them, sorry. Anyways, so The gene tells you you're going to be tall or short. The gene tells you, so those things can't be changed. There are genes that adjust our body's vitamin C level. Okay, let me say that a couple more times. If you have a certain set of genes, the average vitamin C level when you grow up will be higher or lower depending on which gene, just like if you had blue eyes versus brown eyes. If you have the right genes, you'll have higher vitamin C. If you have the wrong genes, you'll have lower vitamin C. So that genetic variation was tested, because if vitamin C makes a difference, for example, in diabetes, then the low vitamin C gene people should have less diabetes. If vitamin C was the perpetrator, the perp, if vitamin C committed the murder, then those people with blue eyes, those people with the gene for higher vitamin C would have less diabetes. Now, that's complicated. Let me say it again. Your genes determine a lot of who you are, okay? The color of your skin, the color of your eyes, your height, your weight, the size of your heart, a lot of things are controlled by your genetic makeup. Not everything. There's a lot of differences, like the quality of your character and things like that, you can change. But there are some things that are relatively fixed, okay? Now, let's think about that. Some of the genes have been looked at. There are hundreds of thousands of genes. And what they've been able to find is some genes, as I said, make you tall or short or high cholesterol or low cholesterol. In this study, they looked at genes that cause a higher vitamin C level. Some people have the genes so that when they grow up, they have a relatively higher vitamin C level. On the other hand, there are genes associated with having a relatively lower vitamin C level on average. And what they wanted to know is, there is other studies, like we talked about before, showing those people with more vitamin C in their bloodstream have less diabetes. So that's an association study. So what this revolutionary study showed is they wanted to know, if you have the genes for more vitamin C, we hypothesize you will have less diabetes. Conversely, if you are cursed or blessed with the genes that give you lower vitamin C, according to our hypothesis, we think this vitamin C is a suspect in causing the murder. We think vitamin C did it. If the vitamin C is lower, we would expect that diabetes rates would be higher. Okay? So this is called a Mendelian randomization analysis, a genome-wide association study of the biobank in the United Kingdom. This is magic stuff. We can do things now that I didn't even understand a week ago. Well, maybe a couple years. Can we tell if vitamin C levels in your genes is associated with type 2 diabetes? Okay. So they did two things. They had the blood levels of vitamin C in the blood of these patients from their doctor visits. They had whether or not they had diabetes. And they had the genome-wide association, the Mendelian randomized analysis, published this year. This is new stuff. Okay. They looked at genes. Do genes make a difference? Do genes make a difference? There is a gene that raises your vitamin C and the Mendelian randomization in plasma vitamin C. And they also looked at just your blood test. They said, well, what's your blood test? A bunch of other patients. If you had high vitamin C in your blood, that means just because you're wandering around, you get a different vitamin C. Okay. And what they found was these two comparisons did not match. Genes, no difference. High vitamin C, low vitamin C from your genes makes no difference. High vitamin C from your genes makes no difference. Low vitamin C from your genes makes no difference. But when we look at your blood tests, high vitamin C, less diabetes. I'm going to say that 3 more times. High vitamin C in your blood less diabetes. High vitamin C in your blood, less diabetes. High vitamin C in your blood, less diabetes. High genetic vitamin C in your blood, no difference. Let me see if I can explain. Actual real world blood plasma vitamin C was inversely associated with type 2 diabetes. More vitamin C in the blood, less diabetes. But there was no association between genetic plasma vitamin C levels and diabetes. How can this happen? It means vitamin C is not the murderer. He's just standing there on the corner when somebody gets shot. But vitamin C is telling you something. It's the canary in the coal mine. The canary tells you the oxygen is low. What is the vitamin C telling us? I want to say that 3 more times. The vitamin C, go out and buy all the pills of vitamin C you want in the world. It makes no difference. It makes no difference. It makes no difference. Vitamin C being elevated in the blood is the canary in the coal mine. It's telling you something. The doctors who tell you to take all these pills are confused, in my opinion. They are jumping to say, this is the murderer. They're wrong. We have the data now. They are wrong. Let me see if I can explain further. Okay. This is another study. It's a different study. Lower plasma levels of antioxidant vitamins in patients with metabolic syndrome. Okay. Conclusion, metabolic syndrome, diabetes, had significantly lower levels of vitamin C compared to healthy subjects. Hello, we found a murder. And guess who's standing near the murder victim? Vitamin C. Same kind of issue. But what we learned from genetic Mendelian randomization studies, he's not the murderer, he's just there. What we need to find out is what the canary is trying to tell us. And that's what we're going to get to soon. I actually told you at the beginning, but maybe I've talked so much you've forgotten. Lower levels of vitamin C compared to healthy subjects meant more diabetes, more metabolic syndrome in this study. That means vitamin C is at the scene of the crime. But from what we know in all these other studies, he didn't commit the crime. He's just there. How can this be? How can this be? Genes that increase the level of vitamin C in the blood do not protect against diabetes. Those born with a body that increases their vitamin C levels does not protect against diabetes. But those with increased levels of vitamin C have less diabetes. Those with increased blood levels of vitamin C have less diabetes. Vitamin C is useless. The scientific community established that a high intake of vitamin C is useless in preventing the common cold. Regular daily supplementation is not justified. A study in 2020. Okay, now FFVs, fresh fruits and vegetables. There is consistent evidence. There is evidence that diets rich in fruit and vegetables and other plant foods are associated with lower overall mortality rates, lower death rates from cardiovascular disease and cancer. Supplements don't work. The suggestion that antioxidant supplements like vitamin C can prevent diseases has not been proved or consistently supported by any of the findings in the published trials. The most prudent public health advice in this study is not to take more vitamin C, but to increase the consumption of plant foods. Such dietary patterns are associated with reduced risk of all kinds of chronic disease. Okay, this is a study of the diet. It's the diet. This is a diet study in Belgium, in smokers. Dietary score of vitamin C. In food, vitamin C diet is associated with subsequent mortality. People may benefit, quote, and a recommendation to consume more servings of fresh fruits and vegetables and less meat. This is from another article. High daily intakes of fruit, vegetables containing vitamins C and E were associated with significantly decreased prevalence of cataract and cataract surgery. The study reinforces the World Health Organization recommendations on the benefits of diets rich in fruits and vegetables. The role of vitamin C in osteoporosis, again, high vitamin C content in the daily diet on bone mineral density. Okay, why are doctors confused? Let's see if I can now explain it. Many studies show more vitamins in the blood, better health. Many studies show treatment with vitamin pills or supplements, no outcome. It doesn't work. How is this possible? The vitamin C in this case is the canary in the coal mine. The vitamin C is telling you that if the vitamin C is low, the person is eating a crappy diet. It's really that simple. The vitamin C, when it's elevated, tells you that person is eating a lot of fresh fruits and vegetables. That's the point. It's not the vitamin C. It's not the vitamin C. When President Clinton ran for re-election, he said one thing: it's the economy, stupid. Don't worry about anything else. It's the economy, stupid. In this case, it's not the vitamin C. It's the diet, stupid. It's the diet. The vitamin C only tells you who the murderer was. The murderer is not vitamin C. The murderer is the diet. The diet kills or cures. Okay, same thing is true with folate, a B vitamin. Blood tests show high folate, low of a chemical called homocysteine. That means good health. Treatment, though, with a pill, vitamin B9 or folate pills, no effect. Does this sound familiar? Just like the vitamin C. High folate in the blood of patients seems to protect from dementia and heart disease, but folate supplements or pills fail. Say it with me. Because it's only a canary in the coal mine. Okay? The vitamin A story is even more tragic. High blood levels of vitamin A is found to have less cancer. The United States Veterans Administration tested 17,000 veterans who were smokers, randomized controlled trial, vitamin A versus a sugar pill. At 8 years, the study was stopped for futility. The sugar pill did better than the vitamin A. That's because it's not the vitamin A. The vitamin A is a sign, a signal of what? That you're eating a healthy diet. High blood level folate, less heart attack and dementia and death, randomized controlled trial, folate versus nothing. Folate no better than the sugar pill. Again, it's not the folate. The folate is a sign, a signal of high vitamin A, less cancer. Vitamin A pills, failure. High folate vitamin, less heart disease. Folate pills, failure. How is this possible? It's a sign. Vitamin pills don't make a difference. What makes a difference is not the sign. The sign just tells you the train is coming. Beware, okay? The flashing lights, the loud clanging of the alarm, they don't kill you. They tell you, though, something's up. What do these studies tell us? High blood levels of vitamin A or folate leads to good outcomes. Excellent studies show pills of vitamin A or folate, no effect or harm. What does this mean? The blood levels are a sign. It's not the sign that kills you, it's the train. For example, folate in vegans is 34% higher than in vegetarians and 88% higher than in omnivores. Serum concentrations in B12 study just done in Nature. Note, this is not junk food vegans, not somebody who eats cookies and other vegan junk. What does a higher level of vitamin C tell us? Measurements of antioxidants in vegetarians show a vegetarian diet remains higher in antioxidant vitamin status, such as vitamin C, vitamin E, and beta carotene. That's telling you that they ate healthy. It doesn't mean that if you give them these pills, they will do better. And again, not if you just eat junk food. You could eat cookies and Doritos and be a vegan, but that's a junk food vegan, and that doesn't work. Okay, folate in vegans, same thing again. Okay, want to protect your brain, your heart, your life in so many other ways? Eat a healthy diet. Pills, supplements, and vitamins are not nearly as important from all the science we can find right now. What are good sources of vitamin C? You know it. Fresh fruits, peppers, strawberries, broccoli, Brussels sprouts, potatoes. If you want to get better, eat better. And a pill won't do it. For example, findings show that compared to non-vegetarians, vegetarians have an almost 40% lower risk of dementia. Hey, I'd like to keep your brain and not get Alzheimer's. Okay, talk to your doctor before you make any of these changes in your healthcare practices. Call Dr. Rutledge's office if you'd like to consider becoming a patient. And thank you all for staying with me. Many studies having shown normal to slightly above normal vitamin and mineral levels to lead to better health. But many studies have shown that taking supplements and pills do not improve patients' health or well-being. Having a normal to slightly elevated levels of various vitamins and minerals can improve your health, but pills don't seem to be the answer. The answer seems to be best addressed by eating a healthy diet. Okay, well, I hope that you suffered through all that. It wasn't too bad, but that's the latest on taking pills and supplements. Thanks for being with me, and stay tuned for our next episode.